athletes. They will go to these overseas, offshore places where different cell formation can be used. The challenge is you don't really know what they're getting. Some of these places are very legitimate. Some of our athletes go down to Colombia, South America, where they're using different umbilical cord blood formulations, which clearly have some value, but you just don't know where these cells are sourced from, how they're manufactured, processed, stored, shipped, all these different things. It's hard to advise the athletes. It really is, and you don't really know what's being done in those centers.
Stephania Bell from ESPN here at AOSSM 2025 in Nashville. I'm so pleased this afternoon to have Dr. Scott Rodeo here with me. Dr. Rodeo is professor of orthopedic surgery and vice chair of research at the Hospital for Special Surgery in New York. He's also the director of the Hospital for Special Surgery Center for Regenerative Medicine and the head team physician for the New York Giants. Thank you for joining me.
Thank you.
You wear many hats in your practice, but one of your particular areas of expertise, and certainly one that I associate with you because I think I come to you as a resource so often, is in the world of orthobiologics. It's such a dynamic area. I feel like it's changing all the time within medicine at large, but also within sports medicine. And I think it's hard for everyone to not only keep up with all of the advancements and the studies that are being published, but I think to filter out what are the legitimate quality studies and what are the takeaways or claims that are real and potentially adaptable into practice. So what would be a few key takeaways that you would say for people who treat athletes, especially in the rehab world, when it comes to indications or expectations and outcomes?
Yeah, regenerative medicine, it's a fascinating area. This whole area of orthobiologics, tremendous growth area, has tremendous potential. But at the same time, there's a lot we don't know. There's a lot of indiscriminate use in this area. A lot of it's aggressive marketing. These therapies seem exciting. They're sexy. They're cutting edge and have great potential. But there's so much we need to know in this whole area. You take, for example, PRP, platelet-rich plasma, commonly used. Like right now, our best data for PRP is knee osteoarthritis. And there's some good data now in using PRP for knee OA. There is some emerging data on PRP formulations for tendon problems as well. Whole other side of this is stem cells. Again, hot topic, very, very tremendous potential. It's out there in the press. It's aggressive marketing. But boy, there is so much we don't know about the cell types and the optimal cell formulations to use. So many, many questions that need to be answered.
What you mentioned the indications, some that are more well accepted, shall we say, for PRP. Could you give a couple examples in sports medicine of where you think PRP has the greatest potential effect?
So PRP, probably the best data is using it for really symptoms of early osteoarthritis, quite honestly. Kind of early cartilage degeneration, knee in particular. We use it a lot there in our athletes in football. There is decent data now on PRP for chronic tendon problems, kind of mixed, but there's some data for tendon problems. Other interesting area, one of the more common things we see, of course, is muscle injury. Hamstring injuries in the NFL, so common. Actually, there's data now that suggests platelet-poor plasma, PP.
Just going to ask you about that. Can you explain the differences between those as you're talking about this?
We're learning, and a good example of how complex PRP is. Besides the platelets in PRP, there are a number of proteins, really dozens, in the plasma portion, apart from platelets, that have a real potential role. So PPP is platelet-poor plasma, actually removing platelets. And the reason is the resulting remaining plasma has a number of proteins that can actually have a positive role in muscle healing. Actually taking out platelets removes some adverse factors factors that can have an adverse effect on muscle. So it just shows how complex this is. The whole area continues to evolve as we learn more, and it shows how complex PRP is, as one example.
As far as stem cells, I think people who are working in medicine at some level recognize that there's different origination of stem cells and different packaging. What stem cells are available for use in the United States as we know it right now?
Stem cells is a great example of, it kind of embodies all the issues with orthobiologics, which is the tremendous potential, but also the indiscriminate use and really kind of aggressive marketing. So, for example, stem cells. To be very honest with you, there are almost no true stem cells that we can use today. Now, that's a bold statement.
It is a bold statement, and I think it would surprise a lot of people
Exactly.
because you hear about it all the time. Come get this stem cell therapy and shave 10 years off your life.
Exactly. So a true stem
No,
cell.
that's not what I meant. 10 years of aging.
Right. Yeah, right. Prolong your career. Now, a true stem cell is a highly specialized cell by any cellular and molecular criteria. Now, there are cells in bone marrow, there are cells in fat, adipose tissue, and even cells in things like amniotic fluids and umbilical cord blood that do have potential. They have some ability to regenerate tissue, but it's a much more limited repertoire than a true stem cell. So it's just, this is just semantics, but to call these formulations that we use today in 2025, to call them stem cells, it really is a bit inaccurate, quite honestly. Now, as we're getting to the point where we can use cell sources from other sources, something called induced pluripotent cells is actually taking a biopsy of skin, just a skin fibroblast, a skin cell, or a blood cell, and using gene editing techniques to make that cell tantamount, equivalent to a true stem cell. We're not there yet. Right now it's kind of in preclinical work, but it just shows that these areas that have tremendous potential.
Sounds like there's more unknown than known.
There
bottom
really is.
line.
There really is.
There's also what is legal in this country when it comes to this versus not. And this is something that you and I have talked about before, but I think it'd be helpful for people who are listening to understand what are the regulations in place that describe what is legal when it comes to these orthobiologic injections or implantations.
Yeah, and the FDA is quite clear on the current regulatory status. So we can take cells from bone marrow or adipose tissue, as I mentioned, and use those, at point of care, in the clinic, in the operating room. What we cannot do is so-called manipulation. Take that out of the clinic, do cell culture expansion in the laboratory, and then reimplant that. That can only be done under a formal FDA trial, under an investigational new drug, an IND. So now in other countries, Japan and Korea in particular, they can do cell expansion outside of the body and then reimplant those cells. So, and the ability to take your formulation of bone marrow, for example, and sort the cells that you want, do cell selection, and then expand those in culture, that's valuable. Then you have some real potential there. We can't quite do that yet. The FDA doesn't allow that. Now, if you followed in the last year with the new administration, there's been some relaxing of some of these rules, and there's a new law in Florida allowing use of unapproved or unapproven therapies. So it's a murky area that really is an example of how this whole area really continues to evolve. But clearly right now we can't take ourselves out of the clinic or operating room and do any of these manipulations that would have great potential. Which actually leads, one other point you could bring up is medical tourism. Because
this is my next question was, how do you counsel your patients, athletes in particular, because they often have the resources to be able to go wherever and seek additional treatment. How do you counsel them when they say, oh, well, I'd like to go overseas and test something out?
That's a great question, and we're faced with it quite commonly by our athletes. So they will go to these overseas, offshore places where different cell formulation can be used. The challenge is you don't really know what they're getting. Some of these places are very legitimate. Some of our athletes go to down to Colombia, South America, where they're using different umbilical cord blood formulations, which clearly have some value, but you just don't know where these cells are sourced from, how they're manufactured, processed, stored, shipped, all these different things. It's hard to advise the athletes. It really is, and you don't really know what's being done in those centers.
It's so interesting because their bodies are critical to their livelihood in the sport, and they're so particular about everything that they consume, nutrition, but sometimes they're willing to take these chances where they don't know exactly what's in the formula or the process.
It's kind of this perfect storm where the athlete has no challenging problem. We, as physicians, admittedly may not have perfect solutions. They have disposable income. They're motivated to get better. All these things conspire to let them be interested in pursuing some of these therapies.
That's not easy. I don't envy you in being in that position of having to advise, but I really appreciate that you're the one filtering through all the information so that people like me can have the key takeaways. It makes it easier to do our job. Thank you so much for spending some time with me.
Thank you. It was fun. Enjoyed it.